to retain their private insurance if they had it and it worked well for them, or that they would also have the option to buy into a government or public option program of choice, which is maybe similar to what you and the rest of Congress has. My other part of the question is, in regarding the public option, I've heard you and other members of the Republican Party state that they won't back the public option. And just a little more extended on your position on that. And so if it's the party's position and your position, if you stated that you will not vote for or back a public option, I would like to know your position, or maybe I understand you've told me Republicans aren't on complete agreement right now, on the ways to reduce healthcare costs. Considering the United States spends the most money, yet we're 35th or 37th in life expectancy, that there's obviously a distortion in the amount of money we're spending and the amount and the care that we're receiving. That's my question. Yeah. Thank you.
Well, listen closely, because I didn't make myself very clear then in Pocahontas if you came away with that reception. There is not a conflict between saying you're for choice and being against a public option. Assuming, and you probably won't buy into this rationale, but this is a rationale that leads me to say that. Okay, you have a public option. Why is that going to reduce choice? Because you say it's going to increase choice. Because you got all the private insurance plus the public option. Health economists that have studied how government gets involved in various areas of the economy figure that government, as the lady said, quoting me, government is not a competitor, it's a predator. Government can never be a fair competitor. If it is, then there's no point in having it in there. So the idea is to undercut private insurance. Okay, health economists say, and this is the Lewin Group, L-E-W-I-N, they say that a small business is going to shove a bunch of people out of their private insurance once a government plan set up and put them in that government plan. Okay, if it's 120 million people, then there's about 50 million people left that have private health insurance, but those premiums go up because the pool is smaller, and then pretty soon everybody opts out. Okay, then following what the congresswoman that you see on YouTube says, the Illinois congresswoman, she's told this group, and they applauded every time she said it. She said, a public option is not our end. It's a first step to get to a government-run health insurance program like Canada has. Okay, then when you get to a government-run program, then you've got one program. You don't have choice. So that's why I say I'm against a public option because I'm for choice. In fact, our whole program, as I mentioned to another person around here, over here it was, is set up the exchanges so that you got more choice. You don't have just two choices in Iowa. You've got choices from all over the country. Choice is what we want. And then the other, well, I guess your question why Republicans don't want to back a public option is because of just what I said. Now, reducing costs is another question. There's one thing, the exchange and national competition in healthcare should reduce premiums by 10%. That's not my figure, that's what people that have studied it have said. If they're wrong, I'm wrong. Then you've got things that we're doing with the change of delivery of medicine that we haven't talked about here. But we got these perverse incentives in medicine where we reimburse people based on quantity instead of quality. So the doctor says, I want to see you every day and twice on Sunday because every time he sees you, he gets paid for you. Now in Iowa, that's not so much of a problem because we're fifth in quality. But it's surely a problem in the parts of the country where they don't practice medicine like we do in the Midwest and the Plain States. And if you can, and we're going to move then in these talks, and this would be kind of not just a bipartisan approach that I'm talking about. This be things that these other bills are trying to accomplish that are less controversial as well in them, even though other parts of the bill are very controversial. Kind of a consensus, we ought to move from reimbursement based on quantity to quality. And then the other thing is 75% of all the healthcare dollars are spent on 5 maladies, diabetes, chronic diseases, whatever you want to call them, diabetes as an example. So another thing that's not very controversial that everybody's trying to accomplish is more coordinated care in those areas. Because we have Kaiser Permanente, Intermountain, Mayo, you have a smaller outfit, Cedar Rapids, you got Cleveland Clinic, you got the Geisler Group in Pennsylvania. They have all been structuring their delivery of medicine this way. They increase quality, reduce costs. We ought to be doing that in more parts of the country, and our legislation would do that. And then the last one I think I've already made reference to is where we're going to have incentives in our bill in the rate making for the insurance companies for incentives for preventive medicine. In other words, pure, you know, don't be obese, don't smoke, exercise, stuff like that. The trouble is, you don't see those as savings because the Congressional Budget Office, which is the nonpartisan professionals on the Hill that tell us whether we're saving money or costing money, they don't score these things. So, you know, these are savings that are coming down the road 4 or 5 years after we pass a piece of legislation, because it takes a while to get them wrapped up.
Thank you, Mr. Geisley. I'm going to throw a little twist at you here. We've been talking about health care, and how many pages is in that that's going in there now? It's a stack of it, this thick.
She said he